When patients come in with heart attacks, they can often be stuck in hospital for several weeks while all of the tests are done, and then we're waiting for operating slots for them. That period of time is really difficult for patients, both on a psychological level, being stuck in a bed, but also on a physical level, because when you're in hospital as a patient, you don't have your own things around you. It's really easy to just sit in a chair or sit in the bed and decondition. I think it benefits everyone if patients are eating well, exercising and getting mentally prepared for surgery.
The anxiety of our clinicians was we need to keep a really close eye on these patients. If their heart rate changes or their oxygen saturations dip, we need to be able to intervene. So the perfect combination was we can get higher risk patients home so long as we do two things for them. Firstly, we monitor them very closely with wearable devices, a bit like we do on our virtual ward environment. But secondly, not only do they go home and get up and move and get to the bathroom, but we give them even more additional health coaching at home to optimise diet, exercise and smoking cessation.
Telling someone that they may be able to go home can be quite daunting because they're frightened. So they need a lot of reassurance, which I give them. So once identified, I'll have a chat with them. I give them the date for surgery. They have my contact number, and I reassure them that I will be in contact with them at home, which straight away puts the mind at rest. There's always the worry that they're going to be forgotten about, they're going to be lost in the system. But that's not the case. Mentally, they're more prepared for the operation. They've had time at home. They're not waiting for surgery in the hospital environment where their infection risk is increased, and this happens and we've had to cancel surgery. They eat better, they sleep better. They're not in that environment where there's at times there's emergencies happening. You know, this can be in a bed space next to someone who's waiting surgery, and an emergency will happen, and it's so frightening for them, and it has a knock-on effect then psychologically for them with what they've just seen.
There is a big and increasing interest in the value of prehabilitation. We're quite used to the idea of rehabilitating after surgery, but why not optimise patients before they head into the operating theatre?
Obviously, having optimised cardiac function before any cardiac surgery is going to serve the patients best when it comes to outcomes. So this can take a number of forms. We can be looking at just little incremental changes. That can be taking the stairs instead of the elevator. That can be going for a walk outside and gradually increasing that. That can be playing with your grandkids. There's really no end to the amount of creativity or ways that people can work on their aerobic fitness.
Personally, I do check up on them post-op and make sure they're well, and they're really good. They're really good mentally. They're more robust. They've been prepared for surgery, and they do seem to recover better just because of that preparation that they've had.
Even before we started this scheme, patients would quite often ask us, can we go home and come back for this procedure? And I suspect that once, as a clinical service, we've got our heads around the fact that we can do this safely and monitor patients and actually improve their condition ready for surgery, there's going to be a massive sway away from keeping patients in.
I think it will be the way to go forward with the hospital pressures as well, bed pressures, and it's just makes sense for these patients to be waiting at home in their own safe environment.
But the next stage will be to try and roll this out for a larger group of patients. So we're hoping to acquire funding to do this in all of our elective patients. So anybody who is waiting for surgery from home, not having necessarily had a heart attack. Remote prehabilitation, remote monitoring for every patient undergoing cardiac surgery in the UK would be a lofty but achievable goal.